Nigeria has continued to be a hotspot for emerging and re-emerging infectious diseases in the country. Outbreak of viral diseases have become a public health burden, threatening the national health security of the country. Zoonotic infections like Lassa fever, yellow fever, Ebola virus disease, COVID-19 pandemic, and the present ongoing monkeypox disease all have serious socio-economic, educational, and political impact on the nation, adding to the associated high rate of morbidity and mortality. Speaking to journalists at the Research Institute, the Director of Research, Professor Rosemary Odu, aired a view on the need for the research work alongside some speakers on the need to track the epidemiology of pathogens of public health importance with the microbial analysis of sachet water in Lagos State.
We have developed capacity. We have some of our staff that have been trained. We can develop assays to look out for any virus. So we have worked in some states in Ondo State. Today you heard Kwara State, Lagos State, Delta State, we're in Edo State, and we are spreading out the more as we're getting collaborators. We're looking out for these viruses that ordinarily we don't have diagnostics in the country to look out for. And you will see many people, for instance, say they have fever. The test is not malaria, it's not typhoid. They don't know what it is, but they still are not feeling well. It's because we don't have kits. We don't have assays that we can use to screen for these other viruses. So we have now decided in Nigeria Institute of Medical Research to screen for these viruses. Are they there? Let's look out for them. Are they there so that we can inform the NCDC, the states and the other policymakers that, look, this is what we are finding, so that we can take precautions.
We are trying to look at the environment and how pathogens in the environment are interacting with the humans. So what is the relationship and how are they adding up to the diseases we have in the environment? So because of that, we had to look at the canals, which is our environment. Then we also looked at the clinical samples, that's the people that are sick in the hospital, to also try to marry the two of them and see if there is a relationship between what we have in the environment and what the humans are presenting in the hospital. So we looked at canal samples and we looked at clinical samples from.
Water is what makes us healthy, wealthy, and rich. And when our water is not pure, that is, the purity of our water is in question, that means we are prone to any other thing that is in that particular sachet water. So checking for the microbes, checking for the parasites, checking for viruses, anything that we have in those water that can be harmful to us is what this particular project is all about. And since water in a cup, according to what we are doing, can be safe, but when you store it for a long period of time, a lot can come into play. So all these sachet water are all sealed and sold not immediately after production, but some days after. Even if we procure it on that particular day, we don't use the whole bag that same day. So what happened between the time of production and the particular time we are picking it up? And is it good for our system? If not, what can arise it? And when we get an infection, now, are we working with an isolate that can easily be treated in our healthcare facilities, or we have to spend more money because we drink polluted water?
However, to worsen the situation, Nigeria has been under the attack of floods, where thousands of persons have been displaced. Flooding, according to researchers, can potentially increase the spread of emerging and re-emerging infectious diseases. Speaking further to journalists, Assistant State Epidemiologist, Delta State, Dr. Ido Tenyi aired a view on flood infectious disease outbreak alongside other professional body.
And the government, in its good nature, opened up about 11 camps, and each of the camps housed nothing less than over 1,000 internally displaced persons. And because of the issue of putting people in a crowded environment, You have diseases that come with overcrowding, like tuberculosis, like respiratory tract infections. And then we also have issues because when you put people in a crowded environment, you provide water, you provide a source of where they can defecate and all that. But then you now have issues that come up because of a lack of potable water. You now have things like cholera. You now have other diseases that come because the flood usually chases a lot of the wild animals into people's homes.
For the yellow fever, we have an active vaccine, which is still very, very active because from the phylogenetic analysis that we did, it's not a new strain. It's still this part of the West African genotype 2 that has been in circulation, which shows that the current vaccine is still active. So there is a need to vaccinate many more people so that they can be immune against yellow fever spread. And for the dengue virus 1, there is need to do more research, and currently there is no vaccine for dengue. And there have been a lot of issues about dengue in some other community, other states. So there is a lot of work that needs to be done to actually track the effect of this dengue virus among the people living in that society.
Medical researchers have said that research is essential to understand, prevent, control, and respond to new and re-emerging infectious diseases, as it is essential for all citizens to be hygienic in nature so as to overcome any outbreak of diseases.